Hi, everybody. Patricia Coughlin again. I've gotten a couple of requests for a little talk about ending therapy, about termination, as we call it in the business. Although, of course, we don't use that word with patients. Um, so let's talk about what the tasks are involved in termination, and also when do you know that it's time? So in ISTDP, what we've found is that I think it's 2/3 of the time, according to research, that the patient is the one who raises the issue of ending because they've actually achieved all of their goals. So when we look at what we would call a natural termination, we're looking at what the original presenting problems were and also what the pathological defenses that were creating and perpetuating the problem. Have they been removed? And even more importantly, have they actually been replaced with something healthy? We want to see people who are passive and resigned, taking an active role in their own life. They're engaged, they're capable of asserting themselves, that depression has been replaced with hope, that isolation has been replaced with engagement. So knowing when a particular person is ready, right, has everything to do with have they actually resolved the issues creating the problems? Have those problems and difficulties been replaced with something healthy? And again, in most cases, the patient themselves recognizes this. They've often gotten much more than they even originally came for. And so they feel ready to end. We can also have what we call unnatural terminations, right? Where someone is moving or they've lost their job and they can't afford it, right? And that's a somewhat different situation. So perhaps I will leave that for another video. But this one is going to be talking about where termination arises naturally because the patient has actually met or exceeded their therapeutic goals and aims. So, what are the tasks then, right? One is to review the process. And it turns out when we're looking at long term follow up and preventing relapse, turns out it's not enough just that the person feels better, right? And again, even has these healthy alternatives, but that they have a deep understanding of how it is they got into trouble in the first place. And they're also very aware of what they had to do internally and then perhaps interpersonally that has resulted in the therapeutic gains that they've been able to attain. So, this deep understanding of self and also of other in many cases is really required for long-term health and for, again, preventing relapse. So we're going to be going over that right at the end, right? This is how you came in. This is how you are now. How did we get there? And what were the important factors as far as you're concerned, right? So I really want to get the patient's view of that, of what was therapeutic about therapy. And then, of course, the other task is to say goodbye and to deal with all of the feelings about saying goodbye to someone who has become very important. Now, it's really interesting that the research on termination, which is not plentiful, I mean, we don't have tons, but what is there is really interesting, right? So therapists tend to focus a lot on sadness and grief, how sad it is to say goodbye. And it's not to say that, people don't feel sad. And especially if the patient has a history of loss, right, or traumatic ruptures in relationship, experiencing those feelings is very important. But what's interesting is that the patients report largely feeling proud, excited, happy, appreciative, right? That the positive affects are even stronger. So that's very important to be aware of, right? And to um, invite, right, all of those feelings of pride around accomplishment, appreciation for your role in facilitating that. And so, yeah, those are, and when I started practicing ISTDP, that feeling of pride and almost celebration was really striking to me. And it was something I hadn't really experienced in more traditional long-term therapy. So just be open to all the feelings that the person has about saying goodbye. And, finally, the question of, well, how long does that take? So, generally speaking, it's related to how long and deep the therapy was. So, if you've been in treatment with somebody for 2 years, right, the process of termination, saying goodbye, is going to be longer, right? It could even be, a month or two of weekly sessions. Whereas in briefer therapies, it might just be 1 or 2 sessions. That said, it doesn't mean it's any less intense. I just ended a 6 session treatment in which the feelings around ending were very strong, both positive and very sad. And again, bringing up feelings about past endings. How do we create a good ending? That really is crucial. Many of our patients have had, really bad endings with people, not just through death, but, divorce and rupture and shutout and so on. And so, um, making sure that you have a positive ending, dealing with the feelings that come up around ending so that you can really finish on a positive note. Again, the research does say that the way this is handled will have a lasting impact. You're either going to be consolidating that positive work and ending on a high note, or if it's mismanaged, it could actually end up undermining the good work that had already been achieved. So I hope this is helpful. Please, again, comments, questions, anything about this process of ending therapy, and we'll talk again next time. Bye bye.